Sofie is a researcher and academic, equipped with a European blend of practical and theoretical data knowledge. Her extensive background in research, statistics, and policy design, including her academic aspirations, position her perfectly to guide our Health Data Agency until a permanent lead is appointed. As the HDA navigates the complex landscape and evolving landscape of data and strives to make impactful policy decisions in healthcare, Sofie's leadership and her ability to log into a computer is essential.
Okay, welcome to the first HDA symposium today, and we hope that today we can lift some of the mystery and perhaps confusion around the HDA and bring some transparency to you. First, a little anecdote. I don't know if you received Spotify Wrapped last year. I did, and it was rather impressive visuals on my music taste. Apparently, I listen 13 days a year to Spotify, and I am sort of a vampire when it comes to my music taste. I asked my husband in the evening, so what about you, your Spotify Wrapped? And he didn't know it, but he said, oh, when I use Spotify, I just log into your account. So suddenly, all my beautiful visuals crumbled in front of my eyes, and I should have looked a little bit more carefully because, indeed, I never listened to Irish folk. I probably listen even less than 13 days a year to Spotify, and I'm not even a vampire, probably, because the data is just dirty. And it's perhaps low quality, it's strong algorithms, not transparent, not suitable for reuse. And it was all about me, myself, my taste. I even got a message from my favorite musician who told me a special message to me. So I just reflected on this and I thought perhaps not quite what we want for health data. So why creating the HDA? Some context. So we all know that at the regional and community level, there are a lot of initiatives in Belgium, and they have been around for quite some time. There's the Health Data Space Alliance recently, there's INA, there's healthdata.be. And these are really a fantastic push bottom up for the HDA to be created. And then top down, we have the European Health Data Space, which looks after primary use, so empowering individuals through increased digital access and control of their electronic personal health data. But also, of course, secondary use, providing a consistent, trustworthy, and efficient setup for the use of health data for research, innovation, and policy making. And so I would say the HDA benefits a lot from being in between those two layers, focusing on secondary use. So that's the context. Now, why creating the HDA? We all know that data sits everywhere, spread out over organizations. In some cases, there were links between these organizations. And we also have a lot of potential users on the right-hand side, government, health systems, patients, researchers, etc. And the HDA really wants to be a facilitating, coordinating organization that allows better access to health data through a data-driven healthcare system, preparing for the digital era as imposed by Europe. But we all know that these are still the realities of today: slow approval processes, poor interoperability, lack of data standardization, poor data quality, and ultimately still too little reuse of data. Now, what is the HDA? And these are two slides in Dutch and French because I took the text from the law. What are the domains, the strategic domains, as put in the law? Facilitating availability of data, stimulating innovation and research, and developing and implementing a policy strategy. Another one in Dutch and French, also from the law. There are 14 tasks defined in the law, and I let you take your time to have a look at them at your own pace. But there is one word I would like to come back to throughout my talk, is the word transparency. And I think you've heard it already several times from the minister. And I will highlight to you what we mean with this for the HDA. Setting up the HDA, we go back a while. The minister also mentioned this. And over the last 1.5, 2 years, I would say the building blocks of an organization, of a program, have been laid out through the help of consultants, people involved in the organization that belong to different institutions. And their building blocks for the program until now were architecture and tooling, the HDA governance with the governing board and the user board, first metadata content, communication with our ecosystem through LinkedIn, bilateral meetings, presentations. The legal ground was laid out last year, the law was decided, and we have a first packages for the Health Data Academy. Now, what we are going to do this year is to move from a program into an organization with its own staff and personnel. So that's going to be a huge recruiting exercise in order then, of course, to do service delivery for all our stakeholders, allow research and innovation. Innovation not only for our stakeholders, also as part of our own processes within the organization of the HDA. What will the HDA do? And I have a snake that consists of 5 parts, and this snake will come back at the top right corner, so you are aware of how we go along in the tasks of the HDA. I really tried to make this a little bit funny. I even asked my husband for some tips with jokes, but he said, this stuff is so dry, there's no way of making this funny. So I'm sorry, but I'll do my best. A health data access body. The HDA will be a health data access body as defined by the European Health Data Space. It will allow access to metadata. It will stimulate verification, support verification. It will increase data literacy and communication, and it will address your data requests. So you can follow on the right, on the top right. First thing, health data access body. What do we mean? So there is different roles for health data access bodies as defined in the European Health Data Space. And so far, the HDA, as it is now, it will take up the role as facilitating, coordinating organization. It will, to some extent, look after processing environment for synthetic data. It will look after processing and being a processing environment for synthetic data. And then it will look after governance of health data. What it will not be is an organization that hands out data permits. So that still has to be decided for Belgium. Now, when we talk about governance, and here I want to introduce some transparency around governance, is that we have, and there's 2 parts of governance which are rather important. It's the ethical framework and the legal framework. And as I said, the HDA benefits from a lot of bottom-up push from existing initiatives already in Belgium, going a long time back, the push from above, the European Health Data Space for primary use and secondary use. But we all know that primary use is very much about the individual patient and the very special relationship with his carer, whereas I hope we can talk about secondary use in terms of the community, the common good. And I think the minister already referred to that also several times. And what do I mean? A little bit more concretely is secondary use of health data is the processing of health data for purposes different than the initial purposes for which the data were collected, so that research is possible and ultimately, again, improve the quality of life of patients and citizens. And this is a little bit my area. If I want to do research, I have an exhaustive register, or I have a very nice representative sample of the population. Of course, opt-out and the right to object will be a right in the European Health Data Space. It may pose a challenge for research. In this case, So the mechanism to involve patients on helping to determine the most relevant research questions from the start offers opportunities. So we may not have to resort to opt out. Another part of governance is, of course, the legal framework. We have data subjects, we have data custodians, and without the patients, no data. Without the doctors interpreting the data, no data. However, legally, data ownership would imply the right to solely decide who can have, hold, destroy the data. The European Belgian legal framework does not recognize data ownership. It confirms the rights and obligations for several parties. And thanks, Griet Henneman, for providing some of those slides. So the same rights for primary use of health data and secondary use continue to exist. Health data as a common good, the right to object, opt out based on informed consent, opt in. That's all still applying. We hope, however, that for secondary use, health data as a common good to maximize data solidarity predominates in the current discussions as health data saves lives, not only yours. Okay, that for transparency around governance. What else will the HDA do? It will facilitate data access via the metadata catalog. And I can assure you that is not simple. The people have worked extremely hard until yesterday to get this up and running. So what we do first is we will inventarize existing data sets. At the moment, we've tried doing this for the 5 founding organizations, RISIF, FOT, FACH, Xiansano, KCE, but of course this is not exclusive. So any data provider onboarding the HDA will be offered to make an inventory of existing data sets. We then will document the metadata and finally offer a tool to search for the data. And at the moment, as far as my last statistic, it was 89 data sets that have been documented so far in the metadata catalog. All of this had to be ready for today so that you can access. What else will the HDA do? It will facilitate verification of data. Everybody knows what FAIR stands for now. Findable, accessible, interoperable, reusable. And how will we do this? By offering guidelines, tools, governance, and coordination. And what does that mean concretely? We have started with a data maturity analysis last year for each of the founding organizations, but again, no exclusivity there. So anyone who would wish to undertake a data maturity analysis is very welcome to get support. And what is this data maturity analysis? This is a systematic evaluation of an organization's existing data management and usage capabilities and practices. And so we've chosen to go for 9 dimensions. And what do? You look at each of those dimensions have very specific indicators behind them. An indicator can be, does your organization have a data strategy? Does your organization have data steward roles identified, et cetera, et cetera. So very specific indicators behind those dimensions. And for each of those indicators, there is in the tool very clearly described maturity levels. So what you do is you go and assess the current as-is situation for your organization. What is my maturity level on each of those indicators? And these maturity levels are at the top, so they correspond to very specific descriptions. And then you define the state you want to achieve in terms of maturity. So you can then identify how to bridge the gap and what does the organization need to do to mature from level undefined to level consolidating, for example. So you can have a very clear implementation plan and data strategy after this type of exercise. So again, transparency, we will be transparent about the results that come out of this data maturity analysis, and anyone who would wish to undertake such an exercise, which I really strongly recommend, it is a very useful exercise, can come to us. What will the HDA do as well? It will increase data literacy of the Belgian health data ecosystem. And what do we mean? We will offer a learning platform, empowering you with a learning platform accessible to everyone. Knowledge center, your one-stop shop for centralized knowledge and information that is created for and by the Belgian health data ecosystem. Leading practices, equipping you with leading skills, and the community, bringing together a diverse range of stakeholders committed to advancing health data practices. It's up and running at the moment, partially. There's a package available. We're not talking yet about training on artificial intelligence. We're really talking about what is metadata, what is a metadata catalog, how do I verify data, what are the legal frameworks from the European health data space, ethical issues, so basic literacy, data management skills, and then slowly building up in terms of our, the needs that we have identified with stakeholders. And I think, again, it's very important to even be transparent about one's knowledge, so that one needs how to improve or increase one's knowledge. Communication. We have tried to communicate with you via LinkedIn, still rather recently started via LinkedIn. The website is up and running. You can scan the QR code and test it. So we will continue to communicate through these platforms, but if there is needs for bilateral meetings or presentations, then we're of course open for that as well. And then finally, the reason why you're all here today, support the data requests via the request process. 3 big steps. So we have the searching step. It starts, of course, with the need for data to address a question. We will have an open data catalog, so that the data that's open out there is kind of gathered at the HTA. You can search for metadata in the catalog, identify your needed data that exists, and perhaps also identify missing data. That's another small innovation step we could take, is do more data scouting, which is really looking for data sets that are open out there. Then after the searching step, you have the request step, and that goes in 2 stages. You fill in the submit online request form, we receive, and then you fill in a detailed request form, and then we go to a go, no-go prioritization process. I will tell you in transparency how this works. And you will receive feedback and next steps before we then, you can access data, use data for agreed purposes, dispose of data, and have a happy requester. What is the process behind the go, no-go prioritization? A little bit also in terms of transparency. We will check, does the requester have the authorization to access the data, the time to access the data, availability of the data, the goal, and then ultimately we have to prioritize. So we will look at type of requester, data complexity, reusability, impact, and planning over time as dimensions for prioritization. I say we, it's a small team of, at the moment, consultants, and these will be, of course, personnel of the HDA at a later stage. I need to manage some expectations here. So, Tanguy, can you please join me? So I am happy to present Tanguy to you. He is our one and only real employee of the HTA, in the sense that he's not at interim and he's not a consultant. So, so Tanguy, how do you feel about the one and only?
It's a great honor to be the one and the only one of the official employee. Moreover, it's a great achievement for me to represent 100% of a public agency, so it's great.
And are you ready for tomorrow when the data requests will come in?
I'm going to be ready, and even more, I'm ready to respond to any data request of any expectation in respect of the agency. And I'm not really alone. Instead of Sofie, there are other people who help us to achieve our goals. There are expert consultants, so I'm not alone. We have a good team. Great.
Good. And how is your...
First time.
Yeah. How is your Dutch going? Because the Flemish, they might introduce data requests in Dutch.
Ja, ja, natuurlijk. Misschien kan ik niet zeggen dat ik tweetalig ben, maar ik denk dat ik zal zijn tweetalig. Maar Zoals in het Nederlands, in het Frans of in het Engels, zijn we klaar om onze doelen te bereiken. So, goed.
Good. And how about the German?
We schaffen das.
That's the spirit. So a little bit of expectation management. So we have a team ready for you, but effectively we are in full speed of gearing up recruitment. Yes. Well deserved. So full speed of gearing up, increasing the personnel of the HDA organization. Our vacancies will be online soon, so please look at them if you're interested and join us, of course, to join the team. Okay, and finally, a big thanks to all of you, because you are part of the governing board and the user board. The icons on the slide show the complexity with which we have to take into account of all these parties, but it was partly thanks to all these energies and critical comments that we have achieved what we have achieved. And then, of course, I have to thank Nicolas Dubois and his team for achieving what we have achieved so far, but the metadata catalog, the website, and in particular for today, the symposium, Manon Mertens and Van Guillemot. Have a wave, you can stand a little bit, for making happen today. That was great. So a big thank you, and thanks for listening, and enjoy the coffee.